And for the next thing of interest, which we're going to discuss, this is under the aspect of trying to interpret X-rays, right? So if you are trying to interpret X-rays, let's talk about the aspect of accessing soft tissues and bones in X-rays. Okay, so it's your ability to actually be able to, on this black and white image, I should be able to identify everything here. Of course, me being able to identify everything here has to do with my knowledge of, knowing the anatomy of this area, okay, to a great extent, So X-rays are very important for accessing bones. That's all those fractures, alignment, okay, and all of that. But they have limited ability to show soft tissues directly. So soft tissues is now based on, I know the anatomy of this place, so I can be able to imagine even things that are not there, So they are usually inferred from direct signs, okay, on X-rays. Inferred, like, I'm not really seeing it clear, but because I know the anatomy of this place, I can guess. You understand? So accessing bones on X-rays, in fractures, X-ray clearly show that there's a break, there's a stop in continuity, okay, displacement or angulation, and it can also show the healing process. Alignment, joint congruency, spinal curvature, and bone positioning can be evaluated. You also look at the bone density, where you are looking at, how thick the bone is. You look at the tumors, infections, and degenerative changes. Okay, you can also see them on X-rays. All right. So accessing soft tissues on X-rays, direct visualization is usually limited. So all those muscles, ligaments, tendons, and cartilages are not well seen, but indirect signs. So indirect, see some lines. So because you know the anatomy of that place, you can now be able to guess, okay? So it could be swellings or displacement of fat parts, joint space narrowing, calcification within the soft tissues, abnormal bone positioning. So you now guess that, okay, the ligaments that are around this place, so they have been injured. Do you understand that kind of thing? So it has to do with a lot about the anatomy knowledge. So clinical consideration is, in orthopedic practice, X-rays are usually the first type of imaging that they will always ask you to do, So soft tissue suspicion, so you just have to be guessing, So pitfalls, relying solely on X-ray may sometimes miss soft tissue injury now. Do you understand? So sometimes you need CT scans or MRIs to have a very clear view of the soft tissues.